morning and welcome to The Point. It is Thursday, September 16th, 2021. Thank you to those of you joining us on the GBN Grenada Broadcasting Network's Facebook page, the Grenada Broadcasting Network's YouTube channel, the website www.gbn.gd, GBN TV channel 7, 11 and 20. Good morning to the listeners of Classic 105.5, 105.9 and Hot 98.5, 98.7 and the folks joining us on Party Grenada and Go to Fet Facebook pages. Joining me this morning is no stranger to the program, the Public Relations Officer of the Public Workers Union, Daisy Hazard, is our guest this morning, and we have lots to discuss as we look at the issues affecting public workers, especially in these COVIDious times. Good morning, Ms. Hazard, and thank you for joining us.
Good morning, Blossom. Good morning, listeners and viewers all across Grenada, Carriacou, Petit Martinique, and the diaspora. And it is indeed a blessing to be able to say good morning this day that the Lord has made today. Because we know, Blossom, that yesterday there were so many terrible shocks. This week there has been so many terrible shocks. And even as preparing to come onto this program this morning, I learned of the passing of a second police officer. And this one really hit home to me because it is someone that I grew up with, Corporal Andy Greenage. And I just want to extend condolences to his family out there, Windsor Forest, Vincennes, Canada, wherever you may be. Sympathy from myself, from the GPW family, from the Hazard family. I also want to extend my sincere and deepest condolences to the GBN staff. Yesterday, you lost a comrade, a stalwart, who was also a very close and personal friend, Mikey Haskell, Mikey P. And so, Blossom, I think the humanitarian crisis that is unfolding in Grenada, occasioned by the Delta variant of the COVID-19 disease, I don't know that there's any of us on this little tiny island, in this big country, that is not feeling the direct impact of lives being affected. I want to start with a scripture verse that one of the executive members shared this morning. And it's a scripture verse from Deuteronomy 31:8. The Lord will lead you. He himself is with you. He will not fail you or leave you. Don't worry. Do not be afraid. And I am not a preacher. I'm not here to preach this morning. I'm here to speak the union's business, the nation's business. But at this time, as we grapple with what is unfolding in Grenada, we can only lean on God's mercy. We can only lean on his trust and his promises that he will never lead us. So over to you, Blossom. I'm sure you have many, many questions this morning.
Yes, I do. With all that has been unfolding in Grenada over the past few weeks, especially with the deaths that we've been recording, it continues to raise the issue and the concern of the safety for our public officers specifically. Especially those frontline workers, healthcare workers. And I guess the question would be what extra measures, not just what measures, because we all know measures that are put in place to help protect us, but what extra measures are we putting in place for our nurses, our doctors, who are directly dealing with patients who may be COVID-19 positive or possibly COVID-19 positive?
Blossom, I want to make a promise to yourself and the viewers this morning. I want to promise not to cry. I know I am emotional and I'm very shaken this morning, as I've been for the last couple weeks, but I'm going to promise not to cry because you said what extra provision is in place to protect healthcare workers. Extra, and you said extra.
Extra.
And there is no extra that we can speak about because even now as a union, we are fighting and grappling, or we are trying to grapple with government to provide basic protection for our workers, just the mere basics. And there's some things that I need to say, Blossom, that in this crisis here now, what is unfolding in Grenada, there is a feeling, and you hear it from certain quarters, almost as if the union should not speak, or that when we speak, all that we should speak about is vaccination, and that this is not the time to speak about workers' rights or to speak about workers at all. And we are not an insensible or insensitive union. We know that right now today, the humanitarian crisis that is unfolding in Grenada, all hands have to be on deck if we are going to come out of this, if we're going to survive. And this is why our union has been fighting to collaborate with government for the last month. Fortunately, we've had 2 meetings with the Minister of Labour. Those meetings were directly about vaccination. And we appealed to Minister Peter David to appeal to his colleagues in other ministries and senior administrators at the level of government to speak to the union. Because even as we hear our politicians and our leaders, our Prime Minister and Minister of Health and everybody else speaking to the nation and talking about collaboration and asking the trade unions and NGOs and civil service organizations and so civil organizations to partner, we are the primary stakeholder that government should be dialoguing and planning with. And that has not happened. We had our first meeting with the Minister of Health and the team on Tuesday, please God. Now, I must say that throughout last year, when Grenada was coping with and trying to deal with COVID, we had the ear and the audience of the Minister of Education. And we attempted to, Health. And we attempted to put a lot of measures in place for the protection of our workers. Measures that should have been in place anyhow, even if there is no COVID. And this year, things have unfolded differently. So we want to say that as a union, we have our mandate. And our mandate is empowered, guided, and demanded by organizations like the ILO. This is the highest international organization that guides labor, the International Labour Organization that was set up in the year 1919, CPSA, PSI, that's Public Services International, CPSA, which I referred to, which is our Caribbean associations and other associations like that. We are guided by them. They have had a lot to say during this pandemic. They have done a lot of research. And so the only voices and the only credible institutions to speak about the pandemic and to guide countries into and out of the pandemic for resilience after and in the protection and safeguard of lives is not just the WHO, it's not just the PAHO, it is also the ILO and all these other organizations and the PWU and other trades union council in Grenada, organizations in Grenada. We take our mandate from there. Because we represent the healthcare workers and frontline workers directly, our voices would be loudest in this crisis here. And let me say on behalf of the Grenada Public Workers Union, we make no apologies for attempting and representing our workers in this crisis. It is our duty of care to our workers, and it is our duty of care to the nation as a whole. So I'm happy we had that covered, Blossom. So if I'm going to say things this morning that are going to make people uncomfortable, because there are some people who prefer not to know the truth, but there are some truths that we must discuss with the Grenadian public. So we have a situation, Blossom, where COVID has caught our nation unprepared in many ways. There is individual responsibility. There is the responsibility of government. We know that government has taken some measures. We know that some of our civil or nationals have gone out there and gotten vaccinated, which is has been the cry of government. We also know that according to government, and those of us who are vaccinated, not enough among us are vaccinated. But the reality is, Blossom, is that COVID is here. Whether we blame, whether we shame, whether we criticize, the reality is that COVID is here. It is taking lives in bundles, in bunches. And the government does not have the recourse where they can just throw up their hands and say, I warned you all and I told you so. Even as we see citizens doing it and saying it, it's not helpful. The government cannot ever do that. They cannot stand back and kind of say, well, I warned you all. We are not saying that they are doing that, but we are saying that some of the actions of government. So when it comes to our workers directly, let's speak about it, Blossom. So we know that government has provided PPEs and that sort of a thing for workers. Yes. We're not going to go into too much details about that because there has been provision. Our workers tell us that, the sizing, the packaging, the inadequacy of it. But by and large, PPEs have been provided. But what we're seeing from our unions in Blossom is that even to get transportation for our workers who have been unilaterally placed on a 12-hour shift, outside of any consultation with the union or workers, we are still fighting with government to get transportation to take workers home after they have worked from 7 a.m. in the morning to 7 p.m. in the night. Our workers do this. They work this 12-hour shift without even a snack or a meal provided by government. So you are talking about nurses and other healthcare workers who are placed on a COVID ward for 12 hours at a stretch every day when they work, and basic provisioning. We were speaking to the Minister of Health, and he was saying, well, I don't know why this is supposed to be a question, because this is supposed to be a basic provision. But there's no point the minister saying that to us and throwing up his hands when that basic provision is not provided. You understand me, Blossom? Okay, I see that my battery is running dry a little bit. Let me just make sure that I don't get cut off there.
Understood.
Okay. I'm in a different location this morning that I'm trying my best to manage. All right. I think that is resolved. Let me just double check that. I don't see a feed into my battery. 1 second, Blossom.
No problem.
Just take over a little bit from me right here. Let me just
No problem.
the battery doesn't die.
Let's take a break, and then we're going to come back and continue the conversation with Ms. Hazard, Public Relations Officer of the PWU. This is To The Point. We'll be right back.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Looking for that injection of vibes and energy, of course? Well, I've got just that. Hi, my name is Gary Mr. Smooth, and I'm inviting you to join me on the Hot Morning Show on Hot 98.5, 98.7 FM. Weekdays, Monday to Friday, 6 to 10 in the morning. I've got a healthy dose of your favorite and most infectious hits sampled with information, news, laughter, and all the other ingredients that go into making the hottest morning show on the radio, The Morning Heat. And while you're at it, don't forget to hit us up on WhatsApp, 435-7517. We've got topics, we've got discussions, calls, voice notes, and so much more. But I can't tell you everything. You gotta tune in. The Hot Morning Show on Hot FM 98.5, 98.7 with yours truly, Gary Mr. Smooth. Kaboom!
Welcome back to The Point, speaking with Public Relations Officer of the Public Workers Union, Daisy Hazard. Ms. Hazard, before we took the break, you were telling us basically that some of the basic supplies that our frontline workers would need for their daily duties are not being provided. Have we raised that concern with the powers that be at any level?
Okay, thank you, Blossom. Thank you, viewers. I'm hiding in another part of the house this morning, and the electricity sort of failed me. Anyways, so Blossom, let's be careful, eh? We are not saying that the tools that workers need to work with, government has not provided them in the main, like their PPEs and, whatever they may be required to look after patients. What we're saying is that there are some basic provisions that should be given to nurses and healthcare workers in any event that ordinarily in the main is not provided. But even now, as we are facing the pandemic, in one sentence, let me say, there has been no further protections. There has been no further provisions for our healthcare staff, our nurses and doctors and so, as they are fighting with COVID. Nothing whatsoever. Whatever staff, whatever nurses and so might have been working with, whatever benefits they may have had prior to dealing with this pandemic right now, that's what they're working with. We have seen a situation where our staff has been unilaterally placed on 12-hour shifts. Now, the union is still here. And when administration is making decisions, they know that the unions ought to be consulted with because we are the bargaining agent for workers. And you cannot unilaterally change the terms and conditions, or you should not, of employees' work conditions without respect to their bargaining agent. We are not quibbling that too much. We will deal with that later because many of our staff have said to us, the 12-hour shifts for them, they are beginning to come into groove with it. And they feel a little better not having to be interacting with the public so much as if they were doing the half-day shifts because they take the buses to come to work. Until last week, I think it was Thursday or Friday, they were still fighting and struggling with how to get home at nights after working 12-hour shifts. Many of them are still doing that. We saw situations where buses were sent to pick up workers at night, but they had to dip into their pockets to find change to pay the bus. And we have spoken to the Minister of Health about this, and he's saying to us, well, in the first place, that kind of provision should be made for workers. So I don't know what is being done. So literally the minister threw up his hands. So if we are speaking to Minister of Health and he's throwing up his hands, who do we go to? How is that fixed? And why should the union even have to be begging government or speaking to government of providing transportation for workers to get home in the night when we know that normally buses stop running early anyhow. And in this instance, the buses have curtailed their service. So we are asking workers who are fighting and dealing with COVID patients to come to work for 7 in the morning, leave work at 7. So by the time they change off, because you can't just walk off the COVID ward and walk onto a bus or walk out there and try to get home. You have to change off. And we are saying, government of Grenada, you have to provide transportation for the workers, and they must not have to dip into their pockets to pay the bus to find small change. We have asked the Ministry of Health only on Tuesday, what about a little meal provision? In a 12-hour day, shouldn't you be providing the workers with even a basic meal or a light snack or some kind of a refreshment? Are they supposed to again walk off the COVID bay and go outside there to try to find some food and then walk back in to try to care for patients? What about somewhere for them to take a rest? No worker, the ILO tells us that no worker should work for 12 hours straight, especially in a healthcare setting, without being able to stretch out somewhere. Those provisions have not been made. You hear them talk about a doctor's lounge somewhere upstairs. Our nurses are saying to us, we are thrust onto the COVID wards. Orderlies, maids, everybody, we are thrust there. No mental preparation. So a worker may walk into work today and be told, you are on the COVID ward today. Now, some foolish person out there might be tempted to say, well, oh, they're nurses, they're trained. That's their job. But this is, you're asking somebody to literally walk into a situation where a disease is so contagious that every day we hear of Grenadians dying. Nurses are not made of steel. Healthcare workers are not robotic. They are human. They have their human composition as well. When they leave work, they go back home to their families. And that's another point, Blossom. Throughout 2020, our union, and I was a part of it, so I'm speaking from first-hand knowledge, we worked tirelessly with the Ministry of Health, with health officials, and we put forward a number of recommendations to help Grenada to effectively deal with COVID, to protect our workers, and to put measures in place to safeguard them in and off the job. And we are saying it is very heartrending to see today that our workers are going to work, working with COVID patients, and going back home to their families. Let's talk about the average cleaner and orderly who works for $800 a month. That's an average salary. And they're going back home to their households. Blossom, these are vulnerable people. These are people who are supposed to be under the poverty line by virtue of their employment. When we see them and we see their families, and so it doesn't reflect that because Grenadians know how to make do. But you are talking about these people working with COVID patients and going back home in the bosom of their families every single day. In preparing for COVID, shouldn't provision have been made that when persons are working directly with COVID patients, that they are not returning home to their families unless they have been tested after working and deemed to be safe. Those are the models that we encouraged, that when workers come to work with COVID patients, they should be working for a number of days, remain on site, get tested after, and when it is safe, go back home to their families, spend some time with their families, and then come back onto duty. So literally what you were going to have was tours of duty. And that is to safeguard patients, workers, families, the nation. We heard the Minister of Health saying to us, they don't really believe that COVID is being spread from the hospital or through healthcare workers. But that baffles the mind. Because if you are telling us that COVID is passed on, it's transmitted through people, and if a positive person has it and comes into contact with other people and they breathe the same air, droplets and whatever, it can be passed on. Where is the rationale that would say that every other Grenadian is passing on COVID, but healthcare workers who are directly working with COVID patients and are exposed to COVID in the normal run of things, somehow, miraculously, would not pass it on to their families, would not pass it on to the community, and blossom what we are hearing from our members, in case the Ministry of Health does not know, in case the government of Grenada does not know, where nurses and so come down sick, their families are also coming down sick. Just as I was coming on to our program this morning, I had a conversation with my president. There is a case where, and I'm speaking about this one case as being symptomatic of what is happening across the healthcare sector in our country. There is a case of a nurse who is COVID-19 positive. She learned that 2 days ago. Her husband, who is also a nurse, was tested and is tested negative. They're in the same home. His supervisor this morning is demanding that he shows up for work to take care of patients. When he spoke with his private doctor, the doctor said to him, "You have tested positive, but you have been cohabiting with a wife you've tested negative, but you've been cohabiting with a wife who's tested positive. And it stands to reason, therefore, that in a couple more days, 4 to 5 must pass before we can clear you to go back and work with patients." So when that worker goes to work, and he works in the mental health care facility, which we must touch on this morning, Blossom, it stands to reason that in a couple of days, we may hear there is an outbreak at the Monge Hospital. And we are not prepared to deal with that because only yesterday, staff was attempting to clean up a section for mental health patients that may come down with COVID. Only yesterday. We are a month and how many days into dealing with the Delta, and across our healthcare system, in so many ways, this virus has met our nation unprepared. You may not like to hear it, people, but that is the fact. It is not only the unvaccinated among us that has been unprepared. It is not only on a country level and on an individual level that Grenada has not made preparations for COVID or taken the requisite steps to be prepared for COVID, if we want to say that vaccination is the route, which medical experts have said. It is also a fact that at the level of government, basic, simple things that should be put in place to safeguard workers and to prepare for COVID was not put in place. And we are only now scrambling to do that. Blossom, the COVID bays and units are in the General Hospital. Let me say that the PWU is adamant that COVID must be removed from the one little General Hospital that we have on island in Grenada. Again, we speak with health officials about it and they tell us, well, in America and Canada and the UK and those places, COVID is dealt with in the main in hospitals. Are you serious? Just was it 3 weeks ago, a month ago? We had our Prime Minister leave Grenada and go abroad to do his medical checkup. What this says is that, what we all know, that our hospital, our healthcare services in Grenada was not adequate to provide the Prime Minister with a medical checkup. A medical checkup meaning that nothing is wrong with you, but I'm just taking precautionary steps to ensure that my health is good. So our hospital was not sufficient to this task. But our hospital, you are telling me, must now compete and compare with first world hospitals that are built to specifications. One section of a hospital abroad could hold the entire General Hospital in Grenada. And you are telling me it is okay to make half of the General Hospital COVID units. Again, in 2020, the PWU begged and pleaded with hospital administration and health officials, do not place it in the general hospital. Place it outside of that compound. Other citizens in our country have added their voice to that. In 2020, they had started trying to fix the private block for COVID. With the intervention of the union, sober heads prevailed, and that was stopped. The COVID unit was placed in a building approaching the general hospital. Now, when COVID came, when we started dealing with Delta, even in 2021, hasty steps, they were still scrambling to finish retrofitting some of the things that they had to retrofit. That's a fact. The PWU is not making this up. Even when Delta struck and patients began arriving, that unit person still had to be doing stuff there. And then we saw that in the first weeks that we were dealing with COVID-19, patients were side by side in open wards along with COVID-19 patients. On the female ward, from bed 19 go back was COVID. Bed 1 to 18 was a regular patient. The PWU is not making this up. This is what happened here. Again, on the male ward, it was the same thing. And then while we have these patients, COVID patients, mixed in with other regular patients, hasty steps were taken to retrofit, to move out the pediatric unit and bring the children upstairs and do all sorts of a thing. And half of the hospital was turned into a COVID bay. And the authorities seem adamant that they are going to go ahead with that decision. It is a flawed decision in a hospital of our size, with the lack of resourcing, with the lack of specifications to our hospital. And we are saying it is not the best fit in a society as small as Grenada, with all our cultural norms and nuances, to have a contagious, deadly contagious disease being treated right there in the hospital. The argument, well, that a pregnant woman might come in and have to be treated, and somebody may have a bike accident or the accident that we saw in Corinth last night, regrettably, and may have to be treated and may well be COVID positive. That's a null and void argument, because it is understood that your general hospital may have incidental cases of COVID-19 popping up and showing up. But to place all COVID patients there, that is a recipe for disaster. And we are asking the government of Grenada to hastily make provision to get the COVID base out of the general hospital.
I want to go back to your comment on the Mount Gay Mental Hospital, and that they were trying to set up a unit, a section for the possibility of a case at the facility. How feasible is it that the facility, the Mount Gay Mental Facility, can effectively accommodate, even if it's just one patient, and the site that they're fixing, they're retrofitting?
Our mental health patients require specific care. Because obviously they are there for psychotherapy and for psychiatric treatment. So our mental health patients require that. And perhaps it may not be feasible to locate them away from the Mount Gay Hospital. But again, what we're seeing now is not that any thought and consideration has been placed into this process to say, can we manage it up there? How do we best manage it up there? How is it going to be best managed? What we're seeing is a little ad hoc, on the spur of the moment, because we've heard that one patient has come down sick. Somebody saying, oh gosh, you mean one of them fall sick up there? And where we going to put them if more come down sick? That has been the discussion. And so we are saying that even now, where COVID seems to have caught the administration and health officials on the back foot in many ways in terms of preparation, actual preparation to house patients, even when you're making hasty decisions, sober heads have to prevail. You cannot just be making willy-nilly decisions because it comes at the cost of lives. Let's just take a point here. I'm sure we all heard about the container that was placed up at the Mount Gay facility, a refrigerated container to house dead bodies. The reality is that we are facing a situation where people are dropping, people are falling, people are dying in Grenada. We see the sad trajectory of what is happening in our nursing homes. I mean, it is so sad to see what is happening to our seniors and elders in nursing homes. We see that trajectory. But even now, as we make decisions must be people-centered. And what we're seeing today is endemic of the pandemic. has been an endemic situation in the healthcare sector where our healthcare sector is not functioning the way it ought to function. It is not running the way it ought to run. There are books and manuals and policies that will tell you how the healthcare sector has to be functioned, how nurses ought to be hired, how they ought to be trained, maids and orderlies and all of those persons. But what we've seen is a systematic dismantling of those policies and taken over only by a policy that says hire as few of them as possible, at the most basic salary as possible, in ways where they cannot speak out and ask for better. That is what has been guiding our healthcare system for the last number of years. And that is why our nurses and so have left in droves. And no attempt has been made to stop the bleeding. The consequences that we are facing today, where we are understaffed and short-staffed, and staff is overworked already, is not because of the Delta pandemic. It's not because of the COVID-19 alone. It is because of the policies that has been directed at the healthcare sector for the last number of years. So let's go back to Monday. Workers called the union panicking 2 days ago. There is a container up here, and we hear the plumber say that none of all you know nothing about it. The managers don't know. I is the boss, because they called me last night and tell me I have to come to run an electric line for LACWA. And so this is how they found out that the plumber told somebody because he was told by somebody. And then they saw the vehicle of the undertaker, branded vehicle that suggested that this is an undertaker. And you place this thing on a mental health facility outside their kitchen without prior warning, with no notice being given to staff that, hey, something unusual is going to happen up here today. And these workers are dealing with patients who are already anxious and has psychosis. And why would anybody have thought that it was acceptable to place that kind of a container on a facility like that? It tells us, Blossom, that when decisions are being made, the worker, the care, the dignity, the life of the worker is not considered at all. What is considered is the policy or the decision to be made. But how does this affect the worker? How does this affect the worker who's dealing with this trauma, just like all of us, but still have to give care to patients? When we enact this policy or we take this decision, how is it going to affect them? There is little evidence that there is anybody worrying about, thinking about the worker and making decisions for their protection and safeguard. And let us be clear, the ILO, through this pandemic, has guided governments and has said every single measure that is being taken must consider the well-being of the healthcare worker, must be family-friendly towards the healthcare worker. Because if we're asking workers to come out and work with COVID patients and to work with patients, what about their children who are home because there are no schools happening right now in Grenada? But what we're hearing is that our workers are being told, I don't care about your children. I didn't make your children. Where's the person that you make your children with? Go and find them. All I care about is that you report here tomorrow for duty to go work in this COVID ward. This is not what the ILO guides. This is not what humanity guides. Again, this was not what the union guided last year. Well, the guidance that we are providing even right now is so that when workers have to come on to a shift to work with COVID patients, they must have some peace of mind. One nurse said to us yesterday, I have a 4-year-old child. Every single person in the yard has about 6 houses. All the adults have COVID symptoms. Many have tested positive. And I have to leave my child. There is nobody, because ordinarily I will ask somebody in the yard to look after my child. And I'm coming out to work and I'm crying because I have left my child and I know that my child is not going to be safe today. And you have managers and supervisors telling people, I don't care about your children. And even in this pandemic, even as people are dying, we have to care about our future, and the future are our children. The future are our children, Blossom.
What alternative do you see to, and somebody pointed this out on, I think it's on Facebook, I saw the comment. Yes. Okay, so let me read the comment or the question on Facebook. If the current medical team is trained, where is the team coming from to govern a separate unit if they were to remove the COVID-19 unit from the general hospital and put it elsewhere?
All right. So first of all, it is not to say that the current medical teams are not trained, because your doctors are trained, your nurses are trained. You have some maids and cleaners and orderlies who have been working with the hospital for 20 plus years. So you do have trained people. And so if you had to remove the COVID units and place them somewhere else, obviously it means that some of that staff will have to go there. And it also means that because you don't have a dedicated COVID staff per se, it would also mean that you'd have to rotate people perhaps a couple of weeks at a time in and out of that facility. Because to expose just one bunch of workers alone may not be feasible, or to ask one bunch of workers alone to bear that strain may not be feasible. But it is a better model for us to work with, because even though this is a model that is persisting at the hospital, the staff that's working with COVID patients, they are working with COVID patients. You understand? So even if you move it to another location, you're still working with the same staff. But more to the point, Blossom, the government of Grenada has to undertake a hasty uptake, recruitment and training of workers. The reality is that if the trajectory of this thing continues as we see it, and we pray God that it does not, we pray God stays hand, we are going to need support. We are going to need more support than what we have presently in Grenada at this moment. This is the mindset of the PWU. This is what we are seeing. Where that support is going to come from, I'm not sure. But the government of Grenada should even now not just be bending their minds to refrigerated containers, because refrigerated containers means that you're preparing for death. But we are saying that more should be done. We should see more actions focused and directed at saving lives. Now, we and again, this is factual. Persons are being interviewed and sent to work on COVID wards right now, immediately. A young lady called yesterday morning, not a public servant. Well, you know, the nurse interviewed me, a senior nurse interviewed me yesterday and told me I could begin to work today in the isolation unit. And she said, Miss, what do you think? Should I go? I have a 9-month-old baby, and she itemized for me the ages of her children. Now, I can't pay anybody a salary. But I said to her, and she said to me, when I go there for the $800 that they're offering me, I have no training. I have never worked in a hospital. I'm not a maid. I am willing to work. I have asked them, can you start me out on another ward in the hospital? So at least I could get a little training on the job. And they say, you're going to get the training down there. Just put on your mask and you're going to get the PPEs and put it on and go. Again, we are asking, didn't the authorities see this day coming when we were going to need more staff? Yes, we saw it, because we know that the healthcare system is understaffed. Many of those persons were interviewed in February of this year. And after the interviews, nothing was heard again until Delta hit the shores of Grenada. And you are now asking those persons to pick up themselves and go and begin to work with COVID patients with absolutely no training. So to answer the person's question, the government of Grenada has to now immediately retrain some persons in our society, maybe some of the environmental wardens, maybe some of the traffic wardens, because the traffic on the roads right now is not so much, and they receive hefty salaries. But somewhere, maybe some of the money that should have been spent on debushing, a program which has now had to be stalled, maybe some of that debushing money can be taken and placed into training some persons quickly, immediately, even if it's 1 week, to act as maids and cleaners and health assistants and stuff like that, because we are going to need those persons.
So how is the PWU helping, whether it be our trained nurses or the people who they're just throwing into these wards? How is the union helping these individuals, these men and women?
Blossom, we cannot help them. We cannot go in there on the wards. And sometimes I wish that those persons who are out there sort of rejecting everything that the union has to say and seeming to think that government has done all and everything that it ought to have done by saying COVID is going to come and people will die. We sometimes wish that they could put on these gowns and go onto these wards and work. And it's possible, because if persons are being taken untrained and being placed on those wards, it's possible for any one of us to step up and say, well, hey, I want to work on this ward. Go try it, put on your gowns and caps and go work for 4 hours on the COVID wards. But how is the PWU helping? One of the things that we are doing, we are open. Our lines are open. And we are here to support our workers. Many of our workers call us. They call us breaking down. They call us crying. And we are now placed in the roles where we have to be counselors. And sometimes we find our workers just need to debrief. They come off a tour of duty, a 12-hour shift, and they just need to talk. Or they're home positive with COVID and they need to speak with someone. Or they're calling the hotline and they can't get to anyone, so they call the union. Or they've been waiting days to get tested and they cannot get tested, so they call up the union and say, I just want to speak with somebody. I want to speak with an executive member. One of the things we are doing now that we've been working on is we are trying to put together a care line for our workers. As to exactly how that will roll out, I cannot say this morning because we are looking at 2-3 models as to how we can provide our workers with some counseling support once they need it. And so that's one of the initiatives that the PWU is taking. Another initiative that we're taking is to help provide some care packages to our workers. So for instance, where they are working on the 12-hour shifts in the COVID bay, we are going to try to provide them with some, tea bags and coffee and stuff like that, some little snacks, and so that they can refresh themselves within the event that they didn't come to work with some lunch, that they can pull something to chew on, as we say in Grenada, and hope that the government will definitely put some things in place. We are attempting to meet, we are writing and trying to engage with every level of government, because different requirements and asks that we may have for our workers, we may have to approach different ministries. Because when we speak to our initial conversation with the Ministry of Health, we have sort of gotten there is not much we can do. There's not much that I can do. And maybe there is a feeling that while we're dealing with COVID, we perhaps shouldn't try to deal with anything else. We know, for instance, workers have no protection. Should they fall sick, should they die, there is nothing for their children outside of the little NIS benefit that they may get. We raised this with Ministry of Health, and we were told, in the first place, all nurses should have some worker protection or compensation because they are exposed by dint of their duty to infectious diseases. But we are talking about COVID. And again, last year, the government had said, let's work together to prepare a care package for workers who may become afflicted as a direct consequence of their duty with COVID, may become sick, may become very, very ill, or even die. And we had a former veteran trade unionist that was assigned to the union to work on that package. And we were given all assurances that, look, I have a love for nurses and my heart is in this because my mother was one of the first nurses to really act on behalf of nurses in Grenada. And today, we are facing Delta. There is no additional coverage for our workers. And government seems not to want to engage the union in attempting to provide some. So in the event that a nurse or someone falls sick today and die, God forbid, nothing more is coming from the employer. We had also asked the government to provide isolation centers in the event where workers fall sick because of working with COVID patients, and they cannot go back to their homes and adequately isolate. That maybe 2 or 3 centers across the island, because we know there's logistics to be put in place for those things, where those workers could isolate away from their families in safety and still keep their families safe. There is no provision for that for workers. And so they go back home and they isolate with their families. And so we are trying to work again. We are pressing on the government to do. So Blossom, it's a lot of writing. It's a lot of trying to engage and just trying to see, as Brother Grimes would say, if we can pick off some of the lower hanging fruits. But our approach to the administration and the lack of engagement that we've seen and the lack of willingness to truly engage with us tells us that there isn't really a will to really do something for our workers. But if Delta is here, we heard of the Mu variant or some other variant. Other strains may come to Grenada one way or the other. And so it means that we have to deal with this thing in the longer run. And yes, provisions must be taken, care must be taken for our workers.
A short while ago, you mentioned there was a male nurse who tested negative. His wife was positive, but the male nurse was told to report to work. We have heard reports of members of the frontline workers who have tested positive being forced to work. Have you received those reports? Is it true? Is it false?
What we have, and we've heard again, hospital administration reject this and say it is not true. And we have said that is not the credible reports that we are receiving. What we are understanding is that asymptomatic persons are being made to work. Where a person is positive, but they're asymptomatic or their viral load is not as high, they are being made to work. We've also heard of persons who have been exposed and should be home isolating or quarantining are being made to work. That is fact. This is true. It is being done. Now, we had some explanations given to us by medical members of the COVID team, medical doctors and so, who have indicated that because it has happened in other countries and where there is shortage of staff and you need hands on deck, persons may be pressed into service even if they're asymptomatic, because the understanding is that the PPEs and the mask and so should protect. But even while we are being told that Blossom, we are also being told that perhaps, is it 1/3 of our population? Perhaps one out of every 3 persons. Was that the statistics we heard 2 days ago?
1 out of 3, I believe.
And we also, 1 out of 3. And we also heard the CMO say, I think it was yesterday, that within the next 2-week period, perhaps half the population of Grenada will come down with COVID. And so, again, we are asking, is it really safe for a worker who is asymptomatic to work? Is it really safe for someone who should be home on quarantine because they've been exposed to cases to continue to work? But it seems as if because we are short-staffed, which didn't start with Delta, workers are being forced and bullied and really pressed to work when they should not be working.
Do you have evidence of that? And then
the evidence are our members telling us that. And the evidence is the 2 nurses who called our president this morning to say, I am positive. My husband has tested negative, but we are cohabiting and we were cohabiting until 2 days ago. So this is the evidence that we have.
Some of the comments on
Hold on, Blossom.
Facebook.
And it's not 1 or 2 or 3 workers. It's many, many workers saying that to us. So even if someone may be tempted to say, well, hey, are they all telling the truth? The question is, can they all be making these up? No, they're not making it up. And again, we were given a rationale and explanation by the Ministry of Health as to why the practice is okay. So on the one hand, the public is being told, no, it's not happening. But on the other hand, we got an explanation that said why this practice may pertain.
There are some comments on the Facebook that, well, I guess you probably just answered it, saying a lot of what you're saying this morning are hearsay and he say, she say. So they're wondering, I guess, if you really have the evidence to show if people just telling you things. Local parlance, people probably just telling you things.
I'm sorry, but I have to chuckle because I find it incredible. I find it incredulous that this is the PWU speaking. We are talking about the reports coming into us from our members. We are talking about the reports coming into us from our Nurses Association. We can't go and test every person who says to us, I am positive or I am asymptomatic. We don't have facilities to test. The government can test. But what we know for sure is that the reports that we are getting from our members cannot be discounted, should not be discounted. And the persons who are out there making those comments should perhaps go and place themselves on the front line, I dare say, and then you can discount those reports. But you cannot sit safely behind your keyboard and say that, how are you? This is hearsay. It is not hearsay. It's the persons in the trenches. It's the persons working with COVID patients. It's the persons who call us and bawl. It's the persons who call us and told us, I just come up a 12-hour shift. I did not get a break for 5 hours. My back is breaking. I'm going home now to my children and I'm going to sleep on the floor in the kitchen because the composition of my household doesn't allow me to sleep on a bed because I've placed my children safely away from me in the bedroom and I bed down on the kitchen floor every night in an attempt to keep my family safe. And I shower outside because I try not to use the bathroom inside with them. Because there's how many of us in the house, and Granny is there, and Nenny is there, and she has diabetes. So I'm saying to you, member of the public, You are free to make your comment. You are free to have your opinion. But unless you are in the kitchen, you don't dispel the heat. You don't say that the heat is not great because you do not know. From the PWU, every single thing that I've said here this morning are the accounts that have been given to us credibly by our members, by our doctors, by our nurses, by our maids, our cleaners, our orderlies. Alive, even as little and no protections have been put in place to safeguard their lives. That's my point here, Blossom.
Most of the program flew past, but let me ask this as well.
Yes, 9:52.
You understand? What steps are the PWU prepared to take to deal with the issue of vaccine hesitancy? Because I've seen encouraging words from members of the unions, not just PW, but unions, telling people, we don't support mandatory vaccination, but get vaccinated. How is the PW, whether it be educational, maybe transporting people to the sites, how is the PW prepared to help ease, relieve, change vaccine hesitancy?
Blossom, we will not commit to transporting people to the site because we did not receive $26 million last year to fight COVID in Grenada. Neither did we receive, what's the additional how much million dollars the government received just about a month ago, is it? So we didn't receive that. Our organization is still a pauperized organization. But in terms of attempting to encourage persons to be vaccinated, I think all of us can come down on this side in Grenada that right now, even now, in the midst of this crisis, what seems to be working is vaccination. And I must say here that our healthcare persons who have come down sick with COVID, the ones who are vaccinated, yes, they went home and spread it to their families, that is true. In some cases, they only knew that they had it when the kids came down sick because they are vaccinated, some of them. The ones who are vaccinated seem to be the ones who are recovering faster and are not becoming as ill as others. But again, the statistics, because you have more of our population not vaccinated than is vaccinated. But to not quibble at all, we want to encourage persons to go out there and be vaccinated. It is a hard task, Blossom. When you speak to people, I don't know if you have been, when you speak to people, the persons who are not minded to be vaccinated, even now, their positions seem to have become even more entrenched. I am not going to take that vaccine. I have been speaking to persons from all walks of life, trying to encourage, and there are persons who are telling you, no way, I'm not taking that vaccine. And so the PWU, we are going to ramp up that campaign. I have told my president that I'm prepared to take the lead on that, and I've been making some strides towards that. We will ramp up our efforts to really speak to people about vaccination, because the loss of lives in Grenada, we cannot continue to bleed like this. And persons tell you all sorts of things about vaccines, but it is more likely that you will die from COVID than you may die from the vaccine. Because the amount of deaths that we are hearing about, we are not hearing that they're dying from the vaccine. What we're hearing is that they've died because they've been COVID positive. And so, yes, the PWU, we feel some measure of responsibility in engaging with the public and attempting to get people vaccinated. But we have to meet people at the level where they are. And even from a national perspective, just pelting out a little leaflet out there and saying, go and get vaccinated. There are people who are telling you, I've made up my mind, but I just ain't ready yet. And I can relate to that because it took me about 5 weeks after making up my mind before I actually walked into a vaccination clinic and got vaccinated. And the nurses had to hug me up. I can admit it, to give me that little vaccine on my shoulder the first time. And so hesitancy could be translated into actual action. And I think that's the point where we are, that there's a large percentage of our population out there who are hesitant. They will take it, but they're telling you tomorrow. I knew somebody who left and went all to St. Patrick to get tested on Monday, but went to the stadium and they said the only thing we're offering is vaccination. But that individual didn't take the vaccine. And I said, but why didn't you take the vaccine? Because on Sunday night, we spoke at length and they made a commitment to taking it. And on Monday, they said to me, I traveled around the island and finally I got a test in St. Patrick because I was exposed. I said, well, have you taken the vaccine? No. And so we might want to say these people are foolish, they're stupid, something wrong with them. We could say all these derogatory things, but that does not help. What we need to find is how can we reach into people's hearts? It's really a battle for the heart right now. It's not about the mind. Those persons who have made up their minds not to take the vaccine, they've made up their minds for now. Those persons who are hovering on the brink, it is about somebody saying, let me hold your hand. I hear you, I see you. Let's go get vaccinated. And I think that's what we all have to be doing right now. If there were almost 30,000 of us, 29, how much thousand of us, 600 or how many of us are vaccinated, perhaps if all of us tried to get one more person, just one, to get vaccinated, we'll get to about half or more of the population.
A question on Facebook. A lot has been said about COVID. Hold on, let me get to the question. However, there are other areas and ministries affected by the virus, including your own ministry, Ms. Hazard. Has the situation improved with public officers, especially in the ministerial complex? A number of workers were affected and no decision was taken to close the workplaces for sanitizing.
Right. So, and that person is quite correct. And this is the point at which our union had to have a press conference and very regrettably advise our workers where you're being compromised, where you've been exposed, and there's been no directive coming from your PS, from your administrators. The WHO, even Ministry of Health guidelines, ask you to remove yourselves from the workplace and quarantine. And so a number of our workers were forced to take matters into their own hands. And it is a position that the union take, and we do not regret taking that position because we believe that in taking that position, we have to save lives. We have to preempt what could have been more disastrous, because every public sector worker goes home to a family and mingles with the public. We are the public. And so what we've seen, I think as of last Monday there was a policy directive that came from the Office of the Cabinet Secretary, which sought to guide administrators as to what should be done and how it should be done once someone has been found to be COVID positive in the workspace. We still see a lot of ambiguity in that document. And so it is left up to individual administrators to implement. We have seen instances, in the case of Carriacou, where administrators seem to have not known how to implement the document, which tells us that there wasn't a discussion along with the document. There was no discussion with the union. There was no consultation with the union on that document. So we were not even able to advise our workers from that document's point of view when we speak to them. But there is a document late. Again, it was after COVID started ravaging Grenada. Again, it's as if our authorities and administrators did not know that these are provisions, these are things that would have had to be done and put in place. So we've seen that policy. And workers, where you feel threatened, refer to the Ministry of Health, refer to their guidelines, speak to your doctor. But we think that by and large, in the public service, the situation is basically contained. Workers are probably working rotationally. Some workers are still being bullied into coming to work every day. But you're going to find that it's human nature, people to people. But we think that by and large, the situation is managed. But we ask our members to be vigilant and to protect your own lives where you need to.
It's time for us to end, Ms. Hazard. Finally, has all public officers received the 4% salary increase? You can include that in your closing statement.
Blossom, again, regrettably, even as we fight the Delta variant in Grenada, our frontline workers, not all public officers have received the 4% increase. Pensioners also did not receive it. And our frontline workers, many of them who are out there with the teams, vaccinating people, testing people, working in the COVID bays, most of them, they are contract workers. Well, I don't even know if we can use the term contract workers, but most of them did not receive the 4%. Even now, even as we ask these workers to make the ultimate sacrifice, the government of Grenada did not see it fit to pay them their 4%. And in many cases, some persons who received it in 2020 and in 2019, it was taken away from them in 2021. We've been giving the government a chance to fix it. And at this point, perhaps it is a malicious and vindictive act. But we are saying, have a heart. You are asking people to make this sacrifice, to put their lives on the line, and you cannot give them $40 on their salaries or $100, which is what the 4% amounts to for them individually. And so no, Blossom. Again, our workers are battling and fighting COVID-19. fighting to save this country and to save lives in this country with no added protections, with no additional benefits, with nothing more than they were working for before confronting COVID-19 in the workspace.
Appreciate you. Thank you very much, Ms. Hazard, for once again being on the program. Always a pleasure listening and hearing from you. And we continue to follow, of course, the works of our public officers. And once again, thank you once again to our frontline workers, whichever area you work in. Appreciate it and appreciate you, Ms. Hazard. Thank you very much.
Thank you so very much, Blossom. Thank you, listeners and viewers. God bless us all.
Amen. Enjoy the rest of your day. Public Relations Officer of the Public Workers Union, Daisy Hazard. Thank you very much, Ms. Hazard, for being our guest this morning. And thank you, viewers and listeners, for tuning in. It's time for me to head on out. I've robbed 3 minutes of the next program here on Classic. And, of course, in Hot 98, Graphic Songs is ready to take over. Enjoy the rest of your thankful Thursday. Continue to be safe, practice the COVID-19 protocols, and enjoy the rest of your day. Bye-bye.